A very good evening to one and all. World Lung Day serves as a crucial reminder of the importance of lung health and the ongoing challenges faced globally. This webinar aims to raise awareness about the lung health and the current obstacles we encounter. With the ongoing impact of respiratory diseases, environmental factors, and the recent COVID pandemic, it's vital for healthcare professionals and the public to comprehend the stage of lung health today. Yes, to address this very important topic, we have with us none other than Dr. Nitin Abhayankar sir. It's an honor for me and a pleasure for me to welcome sir and to introduce him to everyone. Sir is a highly accomplished medical professional with an MBBS and MD in internal medicine, as well as he is holding the European Diploma in Adult Respiratory Medicine. He serves as a consultant pulmonologist and head of the Department of Pulmonary Medicine at Pune Hospital and Research Center, which is at Pune. In addition to his clinical role, Dr. Abhayankar is actively involved in academia as a course coordinator for respiratory therapy at the same institution. He is also the founder and director of the School of Interventional Pulmonology, where he focuses on advancing the field through specialized training and research in interventional techniques. His expertise span a broad spectrum of respiratory conditions, and his leadership in pulmonary medicine makes him a notable figure in the field. So, with this, a very, very brief introduction of Sir, I would now request him to please take over the session. Over to you, Sir.
Thank you for your very kind words, and I hope I can live up to all those expectations that you have done. Today, we are going to discuss about overall our lung health in the present scenario, the post-COVID context, and where we are at this point in time. If we really look at the story, then what we are able to make out is that everybody grows, starts breathing, and the lungs keep growing till about age of maturation happens in most of the people at the age of around 18 to 25, and then it becomes a stability in the middle aged, and then there is a slow worsening where the senility takes over, and gradually the expected dysfunction, complete dysfunction, is expected in 130 or 140 years. Of course, most of us don't make it that long, but there are some unfortunate people, for example, people who are smokers, people getting some obstructive airway diseases. They eventually develop early COPD, and they die out prematurely, much prematurely than what is expected out to be. But all said and done, the lung should actually remain reasonably healthy for a good 100 years, if not more. So I think that's what is sort of the bottom line. But one of the biggest menaces that we are facing at this point in time today is huge amount of exposure to the outdoor air pollution, or air pollution as we may call it. There is a concept of indoor air pollution also, like chula cooking, but the first let us focus on the outdoor air pollution. Nearly 1.3 million people die globally from outdoor air pollution every year. Huge amount of people dying in that kind of way. 2 million people die globally from indoor air pollution as well. So more numbers actually die because of the chula cookings and the indoor environmental exposure to air pollution. So that is also important. These attribute to nearly 5% of the cardiopulmonary deaths, the deaths which are related to air pollution. 9% of the lung cancer death and 1% of the respiratory infection deaths are all contributed to either outdoor or indoor pollution. And therefore, I think it's going to be critical to understand and try and prevent ourselves uh, from dying prematurely. Well, I mean, it's easier said than done. So let's see how do we understand this in the first place. And the first way of understanding it is, of course, the concept of what is called as air quality index. Get that into mind. Look around, and are we breathing a very good, healthy air? Uh, the second part is, of course, despite the fact that you may be having uh, bad weather outside, Still, maintaining certain amount of regular outdoor exercise and walking is important. Avoiding indoor air pollution and smoking exposure is also important. And then I'll touch upon, of course, I won't be talking on the COVID 19 vaccines because most of us have done that, but flu vaccine and pneumococcal vaccines and some other upcoming vaccines like shingles vaccine and respiratory syncytial vaccine. I'll just touch upon that. And then, one way or the other, wearing certain amount of protective mask and social distancing. So, that will be the gist of what I'm going to talk today in brief. But one single thing before I start, which all of us should not be doing, is smoking, because the smoking, typically every single cigarette that is smoked, I think we all know this popular terminology that every single cigarette will reduce your life by 7 minutes. As simple as that. So it's nearly 6,000 toxic chemicals, about 42 proven, and around 242 borderline cancer producing agents is one of the most toxic substances that humans have continued to inhale for thousands of years, one way or the other, in one form or the other. And that would be at least a few hundred years the cigarette is around, and there are various other forms which have been there before it. And that's one of the worst menaces which can happen to a human body and the human lungs. And so we're protecting ourselves from this exposure. Passive smoking is also worse than active smoking. Let's now jump the gun and say, try and understand a little about the air quality index. This is the air quality outside in your city. And the typical AQI, air quality index levels of 0 to 50 is supposed to be good. 51 to 100 is moderate. 100 to 150 is unhealthy for the sensitive groups, people who are having respiratory diseases. 151 to 200 is unhealthy. 200 to 300 is very unhealthy, and 300 and above is directly hazardous. And clearly, in a bad scenario, this kind of air quality index is looked upon at. Very important to get this concept in mind. It is available online everywhere you want to check in. You can check in this. And if as we said, 0 to 50 is good, this air quality is considered to be satisfactory and air pollution poses little or no risk. Many European countries enjoy this kind of a level. For example, Paris enjoys this, but and none of the no precautionary hey precautionary issues are necessary as regards to PM 2.5 exposure. That is a small, extremely fine particles which are there in the air, 2.5 micron particles, which are not a problem. Between 51 and 100, the air quality is acceptable. However, for some pollutants, there may be a moderate health concern, and for a very small number of people who are unusually sensitive to air pollution. So, active children and adults and people with respiratory diseases such as asthma should limit prolonged outdoor exertion when you have this. But sadly, most of the India does not belong to these first two, but we belong to three and onwards. If you ask me, in today scenario, we may have just been into moderate, but most of the times, and sometimes we, when there is a lot of rain that is there in Pune city, we sometimes rarely reached good, but most of the times we are in what is called as moderate or unhealthy for sensitive groups, and that is between 101 to 150. And members of these sensitive groups may experience health effects the general public is not likely to be affected. And therefore, children and adults, active, and people with respiratory diseases such as asthma should limit prolonged outdoor exertion even in this. That is a cautionary statement. But most of the times we live in much worse. And for example, many cities in the north are in 300 and plus zones. So let's start with the hazardous. This is a clear health alert. For example, city like Delhi, and I'll show you an example of the AQI in Delhi, which I just downloaded one day ago. So, health alert, everyone may experience more serious health effects Everyone should avoid all outdoor exertion. This is as bad as that. And this is the scenario of, say, a city like Delhi at this point in time. Majority of the cities in the north fall in either hazardous or very unhealthy. And as you know, in this context, the idea is more healthy the outside air is, please do not venture out, stay indoors, and try and breathe a relatively purer air. But scenario is gruesome, and that's the problem. So these are some of the data which is there from the CDCC, our Indian side. People who are at the highest risk of pollution are essentially people who are elderly, children less than 5 years, pregnant women, people with respiratory diseases like asthma, COPD, so on and so forth, and of course, people who have cardiovascular diseases. So these are the five subgroups which are considered to be at risk. And all these at-risk individuals, whenever the AQI is bad, should stay indoors and not go out at all. Now, if you really look at this, I'm starting the WHO data here. And if you look at India, this is looking good here for NO2, that is nitrogen dioxide. And the value is less than 40. So it sounds great, fantastic. We are in a great shape here. But this is only for NO2. Look at the PM10 data, the large particle data. We are absolutely in more than 100 to 150, which is the highest. And this is one of the highest concentration in the world. Over the last 1 year, we have been in this particular zone. And look at it for the PM 2.5, which is the fine particle data. And the fine particle data also, we are anywhere between 35 to 40. And again, we enjoy the worst quality of air in this country at this point in time. And that's something which I want all of us to take notice of, that if you are going out, beware. It may not be a great idea to be outside. For example, I am in Pune today, and I just put this as an exercise that the AQI. This was yesterday, and in Pashan area it was 125. In Pashan Hill Trail it is a little better, 89. In Shivaji Nagar it was 105. I think it was 150 rather than that, because it is called into the poor zone, whereas the others are called in moderate. And in Vittal Nagar, one of the other areas, it was little better, 83. So we are somewhere in the moderate or a severe or unhealthy situation, even in Pune. Now compare that. I mean, Pune is a moderate, considered to be a moderate weather city, and we are still moderately polluted, or some in some areas it is bad. But look at what is the real time air quality index in Delhi. This is 483 in Anand Vihar, which is one of the top areas in that. And the PM 2.5 is as high as 268. PM10 is 483. So it's a horrible kind of air that the Delhiites are breathing at this point in time. And therefore, this makes it one of the worst cities in this country to live in. And one of the top 10 countries in the world. Delhi is either number one or two, and there are 10 out of 10, 9 countries belong to India. So one has to be extremely careful when we are venturing out in this kind of a situation. I have a misfortune of visiting Delhi on this Friday, and I'll be very, very cautious of not going outdoors. Just stay for a lecture and come back. So now the question that is asked is, how can we reduce our health risk when the air quality due to the pollution is either poor, very poor, or severe? So either we are 150, AQI is 151 or above, or even 100 and above. It's you start worrying, and if you are in a Delhi-like city, you seriously start panicking. What are we supposed to do? How can we minimize the damage? Of course, trying to get the trees around, they shade the buildings, reducing the need for air conditioning. So having a lot of trees in your area. Pune is blessed with a lot of trees, but still the weather is not as good as you want to be. Of course, reducing the vehicular air pollution is one of the important things, but large healthy trees have greatest per tree effect at the air pollution removal. So plant more trees is one of the best ideas. All these will lead to essentially healthier people, reduced heart attacks, strokes, and asthma. And trees also absorb small particulate matter from the air. So that is something which is very important. So getting the city greener, getting your area greener, environment greener is going to be one of the biggest agendas that all of us should have when we are trying to protect ourselves from the ill effects of air pollution. Of course, walking counts. It can be a cardio kind of a walking, but if you are walking in Delhi, for example, where the air AQI is 483, even for a healthy person is not recommended. But wherever I have a healthy air, like in Pune, I go to Sarasbag every day and I walk regularly at least 7 kilometers a day. So, which is associated with increased cardiovascular and pulmonary fitness. It reduces the risk of the heart disease and the strokes. It improves the management of conditions such as hypertension, though it is not exactly all this is not only lungs, but all this is adding to overall better lung finally. Stronger bones, increase muscle strength, and reduce body fat all help. So wherever possible, outdoor walking is important, but be sure that you have the AQI in mind and don't venture out when the AQI is in a horrible situation. So please don't do that. When the AQI is very bad, remain indoors or reschedule your outdoor activities in such a time that the AQI gets better. In fact, many people believe that going out at 5 a.m. is better. But even in Pune city, at 5 a.m., the PM 2.5 and the PM 10 values are worse than say maybe 7 or 8 p.m. on 7 or 8 a.m. So if you do it after 7 or 8 a.m., possibly you are in a relatively better scenario. So one has to understand that this is something worth taking into your mind, that it is worth doing it in that particular way. If you feel that you are breathless, giddy, giving cough, having a chest discomfort or pain or irritation in the eyes because of the air quality, then of course go to the doctor and consult and get yourself diagnosed. You may be having asthma. If that is the story, then you should be on correct therapy, and that will save you up to an extent, of course. Uh, if you are using a face mask, a proper fitting and a properly certified N95 or N99 with a correctly followed user instructions, that mic should be mask should be fitting very well. The so-called simple paper or cloth masks are not so effective. Please, let's not fool ourselves. If you are going to go out in a very bad air quality, for example something like 483 in Delhi, and you are already having a so-called mask which is just a cloth, that's not enough. That's not going to truly protect you in the true sense of the word. So know a little more about the kind of mask that you are using. And I'm sure COVID has taught us about N95 and N99. This is the percentages filtering the 95% of the 2.5 micron particles, and this is 99%. At least N95 is considered to be a good enough. People who have already an asthma or any other lung condition or a heart illness should keep their medications readily available. Of course, it makes a lot of common sense to do that. And of course, as we said, planting more trees, act in time to protect yourself from the ill effect of air pollution. Every tree that you plant today is going to save your future generation also, not only you, from dying prematurely. That is going to be important. What else can you not do? And these are the important don'ts actually. That do not burn firecrackers. I mean, once in a while for fun, it's all right. But the amount of firecrackers that are burnt in a huge, particularly Diwali times, we tend to do that. And going overboard with them, or actually burning wood, leaves, crops, forest, it's hay, garbage, all kind of things. Don't burn things right, left, and center. Be sensible about what you are burning, and is it absolutely necessary to burn that particular thing or not is worth considering before we jump into that kind of a thing. So that's the advice. Of course, I already touched upon this important issue of any tobacco related inhalable product like cigarette, BDs, hookah, shisha, everything is off. Everything is bad for your lungs, and please don't do that ever. There is no question about that. Don't go for a very early morning or very late evening walks, runs, jogs, and physical exercise, particularly in when the AQI is say 300 and above, or the north of 300, as you would call it. For that matter, north of even 150, I would be cautious going out in that kind of an environment for these kind of activities, because they are well intended towards exercise and maintaining health, but you will end up getting worse because you are inhaling bad quality air. The air quality index is horrible, and therefore it is something worth preventing. Now, there are some other things which are very important. And in today's scenario, I am sure all of you have gone through a lot of viruses this year also. In COVID times, we were extremely careful that we would never self prescribe. But today, if many of you have gone through maybe two, three, four viral illnesses yourself, and it is extremely tempting to self medicate. I'm sure azithromycin is the molecule of this country, and everybody pops in a three or five doses of azithromycin just like that. It's a bad idea, and this is believed that this is one of the data put out by GARDP, that overprescription or self medication and regulatory gaps leading to causes of antimicrobial resistance in India. This is 1st December of 2023, and this has led to eventual emergence of what is called as extremely drug resistant bacteria, which inhabit our intensive care units. And this is where you want the best and the cleanest kind of air, and you are infected by bugs which are say NDM producing, or NDM, metalloprotease is producing kind of organisms which are drug resistant Klebsiellas and drug resistant Pseudomonas and so on and so forth. And we shudder at the thought of admitting a COPD patient into our ICUs, because he's going to get colonized by these organisms and eventually get recurrent infections over a period of time, and again die prematurely because of this. So I think this is something which is important. One single slide, but this I will emphasize number of times. A, if you're a doctor, avoid over prescribing it. B, if you're a non-doctor, don't self-medicate. And the regulatory gaps have to be one way or the other filled. But I think this is something very, very important for every one of us to reduce the antimicrobial emerging. In fact, if you really see, we are still the TB capital of this country because there was a bad prescriptioning for tuberculosis going on for a very long time. And now that National Tuberculosis Elimination Program has taken over, and it is now done in a very organized way, our TB cases are actually on a downhill course. So it is something worth keeping in mind that it is there. The last few slides, and they are very relevant. Get a flu vaccine every year. This is not only CDC, but this is the recommendation by our regulatory authorities also. Get a quadrivalent flu vaccine every year. Everybody above 2 months, for that matter, right up to 100 years, is a candidate for a influenza vaccine. It covers the influenza A, two strains of it, which also includes H1N1, and influenza B, two strains of it. Therefore, it is called as a quadrivalent flu vaccine. And everybody should fight flu by taking a vaccine every year, and that will go a long way in reducing the respiratory exacerbations of any kind of a disease if you are flu vaccinated. The other important vaccines at this point in time in India is pneumococcal vaccines, and there are two types of vaccines. One is a polysaccharide 23 valent polysaccharide vaccine, and conjugate vaccine which is 13 valent. Eventually, these two can be replaced by what is called as a conjugate vaccine, which is 20 valent. In the world, it is already available, and soon, within 3 or 4 years, it will become available to us. We are supposed to take these vaccines, particularly if you are above, these are CDC recommendations, but the Indian recommendations are even above 50 years, or people with diseases, for example diabetes, some other comorbidities, they can take it early. And uh, you should take the PCV13, which is the conjugate vaccine, first, followed by, after about a year, you take the 23 valent polysaccharide vaccine. And these are once only if you are above 65, and if you are generally they are not required, but if for some reason you have taken it before the age of 65 and now you have crossed 50 65, you may need another dose. So about 10 years hence you might be requiring additional doses. So that is the way it goes. So at this point in time, we have these two vaccines to be taken sequentially, one after the other. And whether you take this earlier or that later really doesn't matter, but the preferred sequences, take PCV13 first, but you may start with PPSV 23, which is 23 valent pneumococcal vaccine, and follow it by PCV13 after a year. So that's not a problem really. Now, the Tdap vaccination, though it is not respiratory relevant, should be taken every 5 years. That is one of the recommendations. And the other vaccines which are there at this point in time, the zoster vaccine or shingle vaccines has just come here, and it is important that you take 2 doses of that. Shingles, which is otherwise a painful condition, but is associated with a lot of respiratory emergencies eventually. So that is something worth keeping in mind. I'm not going to go through the hepatitis A, B, meningococcal, and other recommendations at this point in time. But another vaccine which you should look out for is actually going to be respiratory syncytial virus (RSV) vaccine. The trials are just starting in this country, and within 2 to 3 years, that vaccine also will become available. It will be a single dose of that vaccine, and people above 50 should be vaccinating themselves with that. So if you have to just put this all these thing in a nutshell, today you can remember two most important vaccines: a flu vaccine every year and the pneumococcal vaccines, generally 2 doses right now, but eventually it be, once the PCV20 vaccine becomes available, it will be a single dose. And also remember, shingles vaccine at this point in time is a little expensive, but eventually the prices will come down, and the Indian production of that will also start. And the RSV, or respiratory syncytial vaccines, from the respiratory viewpoint. There are other vaccines which are relevant from the other viewpoints, and they are not unimportant, but at the same time I won't be overemphasizing on those vaccines at this point in time. So I think I have made myself adequately clear about the importance of immunization. And this particular slide, extremely busy slide, but I'll read out to you that this is the data about AH1N1. H1N1, if you all remember, right, we are talking of pre-COVID. This was the pandemic that hit us in 2009, and this data is from 2018 to 2024. And if you look at 18,000, 38,000, these are the annual total numbers: 13,000, 8,000, 9,000. And if you really see 2023, the 2020 data, I'm sorry whether I'm able to see or not. Yeah, look at that. So in 20, sorry, somehow not able to, sorry. Okay, I'm not able to really read the 2020 data, but 2020, yeah. So there were only 2,700 cases because it was all the COVID time. The COVID took over the globe, it took over the India also in a very big way, and therefore 20 data only 2,700 cases in total reported cases. In 2021, it was only 778 cases, but come 2022, and the cases jumped to 13,000 reported cases, and then they have been hovering at around 10,000 cases. These are the reported cases. If you really ask me, at this point in time, I have in my ICU 5 cases of AH1N1 who are on ventilator, and all these are elderly. So I think what I'm trying to say is we have a vaccine for this. It has been there around since 2009, and even today I have a patient who's on ventilator in a prone position. We are struggling with him for last 10 days. and this was easily vaccine preventable. So flu vaccine is the least that we can do to prevent ourselves from getting into this kind of a premature scenario where the death is imminent and very little can be done at that point in time when you are so ill because of a disease which is vaccine preventable. So I think one of the most important messages of today's talk is prevent the preventable, and it will go a long way in getting your respiratory health going stabilized, as well as you continuing to live much longer on this earth. There's only one life and we don't know what about what is there in the afterlife and all that. We do believe in it, that there is some punarjanma, but I think even in this janma, what is important is one of the karmas that we should be doing properly is at least take a flu shot or a pneumococcal shot. And of course, the so many things which I said about the air quality index, planting green trees. And with that, I conclude my talk. Hope I have conveyed some positive messages in this. And thank you very much for your patient listening. And I'll be taking questions as they are. Over to you,
Right, sir.
Ankita.
Thank you, sir. Thank you so much for an insightful presentation. Now, we'll take the questions that we have received from the audiences.
Sure.
So the first question is that interventional pulmonology has advanced in recent years. So how do
Yes.
you see these innovations playing a role in addressing lung disease, and what are the key benefits for the patients?
Yeah. I think intervention pulmonology is a subset of pulmonology, broader pulmonology, and that deals with either a bronchoscopy or a thoracoscopy. So we make a hole into the chest wall and go inside and see, or we put in a bronchoscope inside the airway and go inside and make an early and an effective diagnosis of something which is otherwise missable. For example, I'm suspecting TB and I don't have a sputum at all, and I can't send it for gene expert, therefore the patient is deprived of therapy. So an simple intervention like a bronchoscopy goes inside, takes a bronchoalveolar lavage, and we have made the diagnosis of tuberculosis, and because we have made the diagnosis of tuberculosis, the patient goes on correct therapy. Sometimes we just had a patient who was treated wrongly for tuberculosis, and this patient had actually infective bronchiolitis, and the bronchiolitis was not diagnosed because a bronchoscopy was not done. So the intervention is a great tool to make a precise diagnosis. So we went in, we took the biopsy of the lung, and that lung biopsy was, or transbronchial lung biopsy, helped us sort it out in such a way that, look, that I am having the proof that there is no tuberculosis. I'm having the proof that there is infective bronchiolitis, and the bronchiolitis gets addressed by appropriate combination of antibiotics and steroids, and the patient is on way. Within 15 days the patient is much better. 8 months the patient was suffering. So I think interventions rightly directed can point you to a correct diagnosis, and all intervention pulmonology is about that. Whatever high end things you are doing, are they all help you breathe better, get an early diagnosis, get effective therapy. And many of the interventions are not only diagnostic but therapeutic. For example, somebody has a tumor in the central airway, and the interventional bronchoscopy with a rigid bronchoscopy can cover it out, can do a laser or APC or cauterize the lesion and open the airway and make the patient breathe better. So many ways interventional pulmonology is of help to all humans, doctors as well as patients, in number of ways. Doctors get the precise diagnosis, therefore they are able to treat their patients better, and patients obviously benefit because they are having that correct diagnosis. Without having a correct diagnosis and pure guesswork is the problem, and that gets obviated or that gets nullified when you use interventional pulmonology in a constructive way. Thank you very much for that question.
Thank you, sir, for answering this query. Moving on to the next one.
Sure.
Yeah, so there is a question of smoking cessation. Sir has already highlighted, but yet the question is, what role do lifestyle factors such as smoking cessation, diet, and exercise play in maintaining lung health, and how can the public be better educated about this?
Yeah. I think the very simple answer to this is a very aggressive stance on smoking cessation. So we, as a group, in fact, we are a group called PACE, Prevent Addiction Through Children's Education, because it's most the world knows that most of the people who are chronic smokers become smokers before the age of 20, and particularly during their teenage years. Particularly, we target 8th, ninth, and 10th standard for educational material and messages. We have a PowerPoint presentation, we have movies, we have created movies. I write poetry, and I write poetry about this also, and we read it out to them. We make the PowerPoint presentation, we show them the films, we make the children ask questions, and we talk to them that look, this is a most dangerous poison. It contains 6,000 poisons like say tar, the tar or a toilet cleaner. And would you be ingesting that kind of stuff? Would you want to ingest that? And the children are very sensible and sincere. They will come up with a big no. Obviously, who would take rastavar's dumber? Who will eat that? But people are inhaling that, and or tobacco chewing for that matter. Again, it's a menace. So I think if that message goes early out, earlier is goes out, it is better. It is extremely difficult to truly de-addict people, but there are measures like bupropion or varenicline, like medicines like these are available. So people who want to quit, even those who are addicted, can be helped. But it's an extremely tough job, because by pure willpower, only 1% of the people are able to quit. But if they take help from a qualified doctor and with a good medicine, nearly 70% of the people who are sincerely wanting to quit smoking can actually go and quit smoking. But the best idea, if you really ask me today, India has the best education system, and we are trying to percolate over the last 10 years with our PACE activities. We have educated more than 5 lakh children across Maharashtra, and we go to practically every district, every taluka place, every village, and we approach the school principals, and with their help we organize this 8, 9, 10 programs for them about the smoking, not starting the smoking, saying no to a tobacco. So I think that's the bottom line or a key message I would like to give, that hit early, hit hard, and hit at the right place, and you will achieve the goals for tobacco cessation or smoking cessation. The diet part of it, if you really ask me, the diet part is more relevant to COPD patients. And people who are COPD patients, they are already having an excessive carbon dioxide in their body. Many of them are retaining carbon dioxide, and therefore carbohydrate rich diets are not so strongly recommended. We are a country which is carb lovers. We have to have our rice and chapatis or bhakris or whatever they are, breads, all kinds of bread. So we are carb lovers. We have to moderate that down, slightly get the fat content up and get the carbohydrate content down, and that will go a long way in preserving lung health for these patients for a little longer period of time. But of course, preventing a COPD is better than this kind of thing. And exercise, the important, this we call it rehabilitation. Every sick person with a lung problem should be undergoing what is called as graded exercise. It could start with a 15 to 20 minutes walk, but eventually upper body exercises, strengthening, muscle strengthening, all this goes a long way, making the diaphragm stronger, pulse sleep breathing, all these breathing techniques, they go a long way. That those exercises are very, very important for re-establishing a lung health which has dwindled, particularly a COPD. When he comes to us, he's in such a bad shape that he's just not walking. He's not even able to go to the toilet and come back without being breathless. And in that kind of a situation, if you push him through, of course smoking cessation is the first step, treating him with appropriate medications is the second step, but pulmonary rehabilitation, which is a part and parcel of the exercise program that we prescribe to them, goes a long way in getting them back to their life, and they start walking more and doing more in life. So I think this is a very, very important aspect of interventions, apart from the fact that um, We are going to give them medicines, we are going to stop the smoking, but also encourage pulmonary rehabilitation through exercises. Thank you.
Right, sir. Thank you so much, and many congratulations to you for doing such a noble cause for awareness at the root level at a very young age.
We have been at it for a very, very yeah. In fact, and that's what the best part. I'll tell you a story, and maybe if you don't have any questions, we can end on that story. That we always keep doing these programs, and one day a medical representative came to me and said, "Sir, आपकी प्रोग्राम की वजह से मैं बहुत बड़ी प्रॉब्लम में आ गया." So, what happened? So I said, my son watched the program, and the film that you showed, it is called Pratidnya. So in that, what happens is that in that film, it is shown that the father is a chain smoker and is continuously smoking, and the child sees it, and says he just takes the cigarette in front of him and starts lighting it. And this is because he is educated by a film that he sees that smoking is bad. So he said, "Dad, you are going to die, so in any case you will not be available, so let me also die." And this trick was done by that child on my medical representative friend, who actually was a chain smoker, and that trick worked, and he quit forever. So all he needed was that jolt from the blue, and if you hit at the right spot, the results are going to be spectacular. Very frankly, our children, they are our future, and they are much brighter than what we are at this point in time also. Not necessarily the young men and women for that matter are sometimes there is a increasing craze of shisha bars and hookah bars, and they will cheat you saying that there is no hardly any tobacco, there is nothing, the electronic cigarettes are great, there is not much tobacco in it. No, please don't get fooled by that, because there are enough harmful contents like glycol and whatnot, and nicotine is there, and nicotine is as bad as heroin, as addicting as heroin. And heroin is one of the most powerful addicting substances in the world. Nicotine is as strong as that in the addiction potential. So please don't go in that direction. That is a very humble request for everybody, young, old, or even elderly, doesn't matter.
Right, sir. Thank you, sir. Thank you so much, sir. I would like to know that how long is that video, that film? Because if we do a public
Yeah, yeah,
awareness session, then we can.
absolutely, absolutely. The Pratidnya is a very short film. It's just 12 or 13 minutes. And the other film is Balan. It is about 40 minutes. And I just have produced Nitimod is my name. You can Google me, and it's on YouTube. And you can see my presentation today, which is in Marathi actually. I'll be very sure shortly putting a poem on this in Hindi also. So it will be available in all regional translated languages also. That's just a 2 minute poem that you can watch and say, um, "Noko's Zurga, Noko's Sevan." Sevan means tobacco, having tobacco seven, and Noko's Zurga means not having the puff. So that's the title of that particular video, and it is worth watching. It's a simple 2 minute video. Please go through it.
Right, sir. Thank you, sir. Thank you so much. So, with that, we would like to conclude the session for today. So, thank you so much for putting all the efforts and putting the insightful presentation, and yes, about the awareness program or the videos, for putting all the informations. Thank you once again, sir, for your valuable time. And thanks to all the
My,
audiences. I'm very sure who have attended the session, they have been benefited. So,
thank you.
thank you all. Thank you once again, sir.
My pleasure and my privilege to be on IGCP and your Met Talks, and it is good to be back with you again. Look forward to being there soon again for one more reason. Thank you very much. Bye
Yes,
bye.
sir. Same here. Thank you. Thank you so much, sir. Thank you.
Thank you.
With this, we are closing the session. Thank you.